Antepartum fetal surveillance. Non-stress test. External fetal heart rate is 20 to 40 minutes. Normal is greater than 2 acceleration, and abnormal includes non-reactive less than 2 acceleration and variable and late deceleration. Biophysical profile. A non-stress test plus US assessment of amniotic fluid volume, fetal breathing movement, fetal movement and fetal tone. 2 points per category if normal and 0 if abnormal. Maximum is 10 out of 10 and normal is 8 out of 10. Abnormal is equivalent 6 points and abnormal is 0, 4 and 2 points. Contraction stress test and external fetal heart rate. Spontaneous induced uterine contraction and normal, no late recurrent variable deceleration. Abnormal late deceleration with greater than 50% contraction and umbilical artery Doppler velocimetry and evaluation of umbilical artery flow in the fetal intrauterine growth restriction only. Normal is high velocity diastolic flow, that is umbilical artery. Abnormal is decreased, absent or revised end diastolic flow.